talk to you. I'm waiting in the waiting room. So whenever you get it open, just let me in and I'll talk to you.
All right. Okay. All right. I think I'm going to go with a virtual background today.
Oh, yeah? Not doing the scissors?
Nah, it's too uncomfortable sitting over there. So this is a lot more comfortable. So.
All right. I'm coming in, so I don't want to double up the audio.
Okay.
All right, bye.
Bye. What's up? You can come in. I'm just setting up for the Zoom here. What's up?
Oh, I'm sorry, I was on the phone.
Oh, that's okay. I was on the phone with Steven. We're getting this thing set up.
We just have so many stuff we have to take care of right away. It's like, could you guys, I mean, I have other things.
All right. So I don't do share screen here, Steven. What do I do? I think more. Okay, let me see. I think if I go to more, make host. Do you want to change the host to Steven Valatico? Yes. All right. Okay. You're the host now, Steven. So you'll be seeing people come in, right? Yeah, they don't have any audio for you. Says your mic's on, but I'm not getting any audio. No, and it doesn't say that you're muted or anything either. I guess you don't really need audio, do you? You're leaving and coming back in? I think I might have to change these blinds. Still can't hear you. But do we really need to have you talk? Okay, so I have to switch you back over being co-host again. Let me do this. Where did I do that? Oh, I know where it is, over here. Okay, you are host now.
Morning.
Hey, Paul, how are you?
Oh, it's Friday.
That's true. That's for sure.
Am I gonna be able to share screens like we did previously?
I think Steven's the host now again. Steven will do that for you.
All right,
Although
great.
we have no audio from Steven, but he's the host, and he's got these thumbs up.
Nice.
So you
Big thumbs up there. All right, thanks, Steve.
yeah, busy times. At least we're not Buffalo, right? Huh? So far.
Well, so far, I do believe that we'll talk about it a little bit, but our numbers are
In that
putting us
direction.
at high risk, to say the least.
Yeah. Let's see how many people come on this. The one we did Tuesday looked good. I saw it on Facebook there, so.
Oh, yeah, I have not watched it. I've heard a few people have watched it, so it sounded like it was helpful, I guess.
Yeah, yeah.
So.
I didn't watch the whole thing, I have to admit. I just saw
Most of the comments were about the big scissors above your head.
Oh, really? Now I got the background here. If I sit in another chair, I can get the big scissors, but when I get the big scissors, it's not very comfortable there. So my knees are hitting the table and everything. So I just stayed in my regular seat and got my fake background here. So.
Gotcha.
Got 17 people in there now. Well, we'll have to wait till Matt comes on anyways, but we can wait till a couple minutes after 11.
Sure.
Right?
Yeah.
I see Tammy's on. Yeah, I have people asking right up on my emails, asking for the login just 5-10 minutes ago. And I did give it to Kelly Kabbalah. She was going to circulate it in the Orleans County people.
Perfect.
Oh, yes, good, Stephen. Yeah. Yeah, we'll, if you do have anybody that's on there already, if you have questions, put them in the chat and we'll operate that way from the chat rather than everybody try to stay muted, except for Paul and Matt. But if you have questions, start them rolling in the chat and I'll read them off from there.
Yeah, and so we'll add this in too. I do have some of my staff on. I see a few of them on there that are maybe skewing the numbers of participants a little bit, but you know, I did ask them to join in, so they're going to monitor the chat box and answer any questions that may pop up in there. Obviously, we can, you know, read them off and I'll answer them as best I can too, but the goal is to try to get as many answers as we can, and they may be adding in some additional links, you know, with emails and different things as we go along that may be helpful to folks also. So
Yeah,
kind of tag team it here, and then I guess if I don't have an answer, again, they can add it in the chat or pop on, I guess, or you know, however we need to try to relay information.
yeah, that worked well on the last one we did because they did give a lot of good information in the chat as far as links to different things. So
Sure.
let's see. I haven't seen Matt. Was Matt planning on joining us? I think.
I see Tammy on.
Yes, I see Tammy.
Not sure about Matt.
I think he's on the phone, so I
Okay.
would go ahead and get started. He didn't want to be the focal point of this event anyways, but
Okay.
yeah.
All right.
Well, where's your camera, Tammy?
No, thank you. You know me,
Uh-huh.
camera shy.
Well, okay.
All right. Well, I'll start it off. We've got over 30 people on already, and people will be coming in as we go here. I'm Tom Turnbull from Genesee County Chamber of Commerce, and welcome to another one of our Zoom meeting with the County Health Department and Paul Pettit. So we've done these in the past, and I think with the changing circumstances of COVID and numbers going up, I know there's a lot of questions with businesses. So we thought the best way is to have another one of these Zoom meetings. And Paul's always been great at answering questions, and he's got some of his staff with him as well. So if you have questions, place them in the chat box. Just list them in the chat box, and we'll get them from there and go from there. But I think Paul's going to open up with a little overview of where we're at and where we're going. Okay, so I'll turn it over to you, Paul.
All right. Thanks, Tom and Tammy, for kicking us off here. I'm going to apologize as I start here. My computer, I think, is literally blowing up. Maybe overuse. I don't know what the deal is, but we've had some IT issues, so to speak, at the county level for a little bit here, and it's, not sounding well. So anyways, if that noise is in the background, that's what that is. I apologize about that. But it'll probably, there it goes right there. So if you hear that noise, that's me. So yeah, I just wanted to just take a minute and run through a few things. Obviously, what we're trying to accomplish here today is to answer questions that you guys may have from the business community. It's been a while since we've done one of these type of Q&As, and obviously we had a bit of a lull over summer and through the early part of the fall with COVID activity, where it was not to the level where we were having significant cases. Obviously we went many days in a week at sometimes without any positive cases. But as we, put out information continually every day throughout that period, there was, I guess, an expectation, obviously, that we would start to see increased activity again. And unfortunately, that has come to fruition. We have seen a significant increase in activity over the last month and a half, more specifically the last 3 to 4 weeks, particularly. So what I wanted to do today is, go through just some real quick highlights, because again, I want this to be a time for you guys to answer questions. And as Tom mentioned, I do have folks answering questions in the chat box as we go along. So we want to try to get to them as many as we can. And obviously, if we can't, by the time our time's up, you can get those to Tom or reach out to us directly at the county. Again, we want to be a resource to everybody and make sure we can try to provide as much factual information as we can. With that being said, things change quickly, as we've all continued to see throughout this pandemic. We continually get new information, sometimes daily, sometimes weekly, and nothing has really changed from what I told you several months ago. A lot of this information, literally, we find out about it at the same time as everybody else. And usually the guidance documents and the supporting information that goes along with that usually takes 2 to 3 to 4 days after the information is released by the governor. So continues to be a challenge on that end, but ultimately we do our best to try to interpret it and make sure we can relay that information to you folks as real time as we can. But as I start, I first wanted to, oh, there's Matt. Hello, Matt. Just hopped on. Yeah, you want to say anything?
Paul, I appreciate you doing this again, talking to Tom, and I'm glad that we're able to put this on. I just jumped off another Zoom meeting. We did our 30-minute quick hitter just a couple days ago, and Tom had given us some feedback that a lot of business owners had a lot more questions. So we talked and thought this would be a great opportunity for a direct question, not relaying it, not interpreting it, but letting every individual as a business out there ask the questions of the professional. And Paul, I know you'll give great answers, and when you don't have the answer, we'll go looking for it. So Thanks a lot, Paul.
Sure thing. All right, so I guess just before I get into some of the data and information, I did want to personally thank all of you. I know you guys obviously are business owners and work for different businesses in the counties here. And, we know it's been a long 9 months, and it doesn't seem to be getting much better as we're entering in a new phase here, so to speak, and things seem to be getting a little more active, right? And we have our new cluster strategy, micro cluster strategy that the governor's put out there. But ultimately, I believe overall you guys have done a great job. When we look at the type of case contacting and in businesses overall over the last 5, 7, 8, 9 months, it really does show that you guys have taken this seriously. You guys have put in together very solid and appropriate COVID plans. Overall, again, we have seen that carried out to fruition. So I just wanted to thank you all for your hard work. And I know it has not been easy. A lot of you have struggled through this, from just financially and trying to stay open and make sure you guys are, delivering the services in a safe and effective way. And this is a collaborative effort from the, community, right? And trying to keep us all moving forward and getting through this. And, hopefully we're getting to the point where we'll have some vaccines and maybe start to move past, this pandemic. So with that, I just want to say that first off, so thank you for all of your efforts and what you continue to do and through this challenging time. There's no doubt about it. And we're doing our best locally to try to interpret and make sure we're advocating for you. That's a very important thing that we do continually. We talk about it all the time, but obviously we're well aware the governor's calling the shots on these different strategies and how he's putting restrictions in place. But we do advocate. We try to push back locally and through our state association on things that don't make sense, right? And why are we doing this, or why do we have to have these type of restrictions? We're getting local data that may say something different than what the restrictions are putting in place. But unfortunately, in the end, it really is their call at the state level on these things. But we do advocate and try our best to make sure there is common sense and, number one, based in data, not just some arbitrary thought process. So, all right. So I want to run through some numbers real quick, and then a couple other things, and then we can get to Q&A. But obviously, our numbers have been increasing significantly locally, and we continue to share those out on a daily basis. And I would say easily in Genesee County, we're averaging close to 20 cases per day. And if you continue to look at that, going backwards a little bit, I had our folks pull some data. On September 1st, we had 281 positive cases in the county. On October 1st, we had 311. November 1st, 375. And as of yesterday, I don't have today's numbers in there yet, we have 635. So literally from September, basically October 1st to now, we've doubled our positive cases. And from November 1st through less than 3 weeks, we have over 250 cases in Genesee County alone. Orleans data tracks very similarly, little bit less, but proportionally about the same. Again, Genesee has about 18,000 more residents. So ultimately, you can see we've had a significant increase in activity, which has really been problematic from a case investigation and contact tracing standpoint. Again, in Genesee County, we have close to 700 people now in mandatory quarantine with over 130 active cases. So these are the highest numbers we've ever had throughout the pandemic. And it's interesting. I talk to folks all the time about this, and it is different than it was back in the spring. You may recall, obviously from the business side, everybody was shut down, right? Things were closed down, everybody was home. So when we did have cases, it was usually 1 or 2 exposures. It was the husband, spouse, wife, kids, grandma, grandpa, whoever was in that immediate family structure, because no one was going anywhere, right? No one was out and about, everybody was home. At this point, that is not the case of what's going on in our community. Obviously, we're open, albeit it may be reduced capacities, but there's a lot of social interaction. And with that, our cases and our case investigations are identifying, 10, 15, 20, 25 exposures, right, per positive case, which is really driving a lot of these quarantine numbers. One other thing just about the cases, that locally that we've identified, they're really being driven a lot by mainly 2 types of situations. One is social gatherings. We've seen a lot of cases recently, last few weeks, tied back to parties, birthday parties, gatherings. We saw a spike after Halloween. These type of gatherings, because what we've learned, again, this is actual data and factual on our case investigations, that social distancing, masking is not adhered to on the private side of life. You guys on the business side obviously have to follow your safety plans. You're required to make sure people are masked when they come in the store. Your employees are masked and social distance. But that's not the case, obviously, when folks go home and they're in their own homes or having gatherings. So that has really been a significant driver of the number of cases we've been seeing. The other thing that is more, I think, pertinent to this call also is we've seen a significant increase in cases related to workplace exposures, and primarily driven from employees working symptomatic. Again, it's difficult this time of year when we're in our traditional flu season and other type of colds and viruses that are circulating. Everybody has sniffles. You come in from the cold, you got a sniffle, you might have a little scratchy throat. Unfortunately, these are all COVID symptoms. And what we've been seeing is several of our cases in the last, again, 3 weeks to last month, month and a half, have been related to workers coming to work and having mild symptoms, but they work anyways. And again, depending on the practice in the work environment around masking and distancing, it has led towards a fairly significant transmission and spread between coworkers. Then they take it home to their families, share it with their loved ones, and there goes the cycle, right? So really these two areas are what's been driving a lot of our cases, which is, you know, obviously impacts all I do on this call, actually at both levels, in the workplace and at home. So we're working on educational messaging and trying to, you know, make sure that people are being really diligent and working hard to, you know, look at these two areas. Obviously, the governor continues to come out with different strategies. I'll talk about the micro strategy in a minute. But again, he did come up with a statewide, another restriction that went into place in the last couple of weeks that included obviously closing of restaurants and bars and bowling alleys, gyms, obviously high risk activities after 10 p.m. And then obviously the very controversial 10 or less private gathering restriction. So, you know, and again, I believe that that was driven out of what we've been seeing and what I just explained on the private side of life with increased activity in cases. Obviously, that's impossible to enforce, and there's no, I think, local push for that. It's more educational on our side that we really are encouraging folks to, you know, think about their exposure and risk, and you know, try to reduce densities as best as we can, right? Try to limit as many people as we can gathering together. It's going to be challenging. It's the holiday season, and obviously there's a longing and people want to get together and you know, gather, and we get that. I want to do that also, you know, with my family and loved ones, and it's a challenge. But what we do know about the spread of the virus right now, it is circulating quite heavily in these private gatherings and settings, and we're really encouraging folks that especially have you know, maybe older adults and those with underlying health conditions to be very, very careful, because those are the ones we're really worried about. You've seen our hospitalization rates start to climb. We have over 8 folks hospitalized in Genesee County and 3 in Orleans. We're starting to see some more community deaths to COVID. So we do know that activity and the severity of it is increasing, and we just need people to be vigilant now more than ever, even with COVID fatigue, right? And how tired we're all getting of it. So I just wanted to share real quick some regional data that may be helpful for folks to see. Let me see if I can pop this up here. All right. Can people see this? Yep. Okay. So this is a daily report we get out of the Finger Lakes region, and I shared this a bit, you know, going backwards when we had these calls a bit ago. So just so people have a little bit idea where we're at regionally, you can see that our 7-day rolling average is around 343 positives in the Finger Lakes region, and this includes obviously Monroe's the big elephant, right, in the big data. And if anybody watches Monroe County news, you'll see that they keep setting new records. I think they had 373 positive cases yesterday. But as I roll through this real quick, you can see the trend lines here. So the blue line is 7-day positive rolling average, and the red is 14-day rolling average. So again, regionally, you can see you know, how it continued to increase, obviously trending down the last couple of days, which is a good thing. As we roll down here, you get into a little bit more county-specific data in the region. So for us on the call, you know, obviously we're paying attention to Genesee and Orleans. So Genesee is this blue line. And again, this is 7-day rolling average. You can see we're hovering around 5%, just dipping down below 5 here. In Orleans, you can see we've actually been up over 6% positivity rate for a few of the days in the past 7 days. Jumps over to a 14-day, so the numbers are going to be a little bit lower on 14-day, but obviously Orleans over 5% over the last 14 days, and Genesee a little bit over 4, almost 4.5% on the 14-day rolling average. Hospitalizations, again, I mentioned this is a concern regionally. If you take this chart going backwards to actually late October, our hospitalization per 100,000 was about 0.6. So literally, if you take this chart again going back this way, it's trending up in the wrong direction. And this is regionally, and again, you're seeing that in our cases locally in Genesee. This is really one of the bigger concerns that we have. Again, we're getting into talks now of bed capacity and availability for not just hospitalizations, but also ICU cases. We continue to talk to UMMC, and they're starting to get strapped already locally, in addition to obviously our bigger hospitals in Rochester and Buffalo. And we haven't even really kicked in flu season yet, right? That's just starting to go too. So these are overall hospitalization utilization 225. And again, this was back down around 50 or 60 going back a few weeks. The orange box is total ICU cases. And again, that continues to increase. This is available capacity in the hospitals. And again, 30% is the trigger where we start having some problems. Again, we're not there yet, but it is starting to fill up. Testing volume, obviously this continues to go up with more tests being out there. This big spike here is really driven by Monroe County when they went yellow. Obviously they had to do a lot of testing in the schools. I think they tested about 15,000 folks last week as part of the yellow cluster initiative. So that drove, a lot of these averages on the daily. And age group wise, again, this just gives you a breakdown of where our positives are, kind of their average age groups. And the overall average age of our positives is 39 years old. This is our COVID symptom tracker for the region. And again, this is people that sign up and report every day how they are on their symptoms. Again, over 1% now are reporting COVID-like symptoms on a daily basis. Last I knew, there was about 80,000 people in the region that actually put this data in every day. So out of the 1.3 million or so in our region, it's about 7-8% maybe do that tracking surveillance system. And regional comparison, just again around the state, Finger Lakes continues to be at the top, just below the western region. And then, again, per 100,000 per week, still up there, 28.5% per 100,000 positivity rate. And just the last one here, the schools, they track cumulative cases in the schools. And again, this is students and teachers in person learning, and part of the school district, 604 students and 279 teachers. So anyways, I just want to show that to everybody, give a little bit of some perspective on where we're at related to the regional numbers. All right, so a couple things I want to go into real quick. So the microcluster strategy, I think that's something that's probably very pertinent and something that a lot of you may have questions on, especially from the business side, as this is going to be impactful for us if we enter into a microcluster zone. As I mentioned, with our rates I just went over a little bit ago, I believe we're probably on the verge of potentially going yellow. We're not quite there yet that we know of. The data and the metrics and how this is made up is I'm not saying secretive, but really the state is the one that's tracking all this on, because it really, the micro cluster idea is it's small, right? So it's not the whole county at large, it's not the whole region at large. It's really driven by zip code, census tract, and it's based on the positivity rate within those census tracts and those zip codes. And obviously, as we talk about our raw numbers for the county, again, if you look at it in these specific areas, we do believe there's some areas in the city of Batavia and town of Batavia that are probably getting close to potentially triggering that level. So we are monitoring that closely, but let me share another screen here just as I talk that may be helpful for folks to see if you have not seen this yet. So I can bring this up. All right, so this is for New York, as we've talked about many times, is the one-stop shop for COVID information. So anything you're looking for related to business guidelines that you guys are probably well familiar with, to travel related quarantines or testing, and now to the cluster strategy. This is all on there, but I just wanted to bring it up so folks could see it as I talk real quick. So Genesee County is a tier 3 county and Orleans County is a tier 4 county. So if you look at the different criteria here, this is what, let me see if I roll up and see what the categories are. So this is basically how they're determining when you go into a microcluster. So the first, there's yellow, orange, and red, and then additional factors. So I'm just going to roll back down to tier 3 and 4. So you can see we have to have a 7-day rolling average with a positivity rate above 3.5 for 10 consecutive days. And geographic area has 15 or more new daily cases of 100,000 residents on a 7-day average. So that puts us yellow, which I said, I think we're getting close to this. Our raw numbers definitely put us above 3.5 in Genesee. And for Orleans, it's 4% for yellow, definitely above that. What we have heard is that the regional control room is supposed to give us advance warning. They're supposed to let us know ahead of time if we're going to be going yellow, as in like the week before. We have not gotten that call yet. So I'm very hopeful that that means we're not going to be going yellow next week. So we're still waiting to hear. Obviously, we do know that there are some step down on restrictions if you happen to go yellow, orange, or red. And then obviously for the orange and red is they're up there again, 4.5% for orange. And again, based on the numbers I just told you, we potentially, from the numbers may even, be in jeopardy of orange level. So, just something to keep in mind. I'm going to jump over to one more screen share here. Let's see. All right, so this is really probably what you guys care about more, and hopefully you've seen this. If not, it is on Forward New York. You can dive into it. All the different regulations around the microcluster strategy are there. So for yellow, if we happen to go yellow, it's going to impact the zone or the zip code that's defined by the state. Again, we don't have any control in that. It's really driven by the positivity rate and the per 100,000 rates in those zip codes. It may be potentially a census tract in the city of Batavia. It could be a zip code. It could be the whole city. It could be the whole town, including the city. It may be, the town of Elba or the town of Lindenville. We're not quite sure how that plays out yet. But what happens is they'll be designated yellow. So if you've paid attention to Monroe and Erie and you've seen those charts of the yellow zones, it looks to be mainly town driven. So that's something just to keep in mind. But what's going to happen is if you're in that yellow zone, essentially restrictions and reduced capacities start to come into play. So non-residential gatherings go down to 25 people. Right now, we're still at 50. This is for in your businesses, in the community setting. Obviously, we're all under this 10 or less on the private side. Residential gatherings, 10, which is what we're at now. Houses of worship, 50% of maximum capacity. Businesses, again, for you guys, are open, right? You're at your COVID normal operations, so no real change on the business end if we go yellow. Dining wise, this does impact, food service operations, so it starts getting a little more restrictive here. 4 persons maximum per table. And again, the governor's already changed the next one. Bars and restaurants close at 10 p.m. for on-premise consumption. All right, so schools, obviously, I'm not going to get into schools. That's a whole nother animal to talk about. But they have their own restrictions on testing when we go to the yellow. Orange, again, more restrictive for the business side. Obviously, we get down to closures, pretty much, certain high-risk non-essential businesses. So they list gyms, fitness centers, barber shops, hair salons, personal care services are closed in orange zones. Outdoor dining and takeout delivery only. So it starts to, and you can only have 4 people max at those. Now, obviously, that's not helpful in Western New York in the winter. You're not going to go sit outside and dine. So pretty much it means it's pretty much takeout, carry out services. Again, going back to where we were, last April and May before we started opening things back up. And then again, red is obviously the most restrictive. This is, the hot zone, they would consider it. Non-essential gatherings banned, residential gatherings banned, houses of worship, 10 people or 25%, whatever's less. And again, from the business side, non-essential businesses are closed. So again, this is going backwards to where we were pretty much in that April, May time zone. Takeout and delivery only from the restaurant. So again, these shifts would get much more restrictive per color zone. And again, locally, we know Erie County now has some oranges. So basically the whole city of Buffalo and the surrounding suburbs are orange. So they're now under these criteria, and it's really gonna, I think, be very unfortunately impactful for a lot of their businesses that are going to be closed, and then obviously the restaurants that now have to go back to basically takeout only. Anyways, that's a bit on the strategy. And again, we can answer questions in a second. Anything specific on that, again, feel free to shoot them into the chat box. Hopefully my folks are trying to answer anything that's popping up there as we go along. I want to talk about travel real quick. So obviously the governor changed and modified the travel restrictions. As we know, we've been working under this travel advisory since kind of late summer, where obviously if you traveled to certain states with high infectivity rate and positivity rate, you had to quarantine when you came back. The governor did add in a new option around testing out, and basically did away with the weekly updates on the advisories per state. Basically anywhere in the country now that you travel, you have to potentially do this testing and or quarantining. The only exception is our contiguous states that surround New York. It's still advised not to travel to those states with high positivity rates, but there is no quarantine or testing requirements per se because they are contiguous, and that's the way the governor set it up, I guess. So bottom line, the testing piece is not as advantageous as one may have thought. It is a little more challenging. We've heard a lot of concerns and complaints. We get a lot of phone calls on this. The reality is if you want to try to test out, you have to get that negative test within 72 hours of coming back. Everybody quarantines for at least 3 days, but on day 4, if you're testing out, you can go get a test on day 4. And if you have 2 negatives, so you have to have 2, one 72 hours of coming back, and then 1 at day 4, you can test out of the mandatory quarantine. This has been a challenge. Obviously, people are having trouble finding these access to the test out of state, just like people are having trouble here locally. So that's been a challenge, and we know that insurances have not really been overly favorable towards paying for this optional testing. So a lot of people are having to pay out of pocket to get it, which can be very expensive if you can find it. Then again, you got the same issue when you get back here. You got to get that test on day 4. So again, although it's an option, it has not been this great option that has been really beneficial to a lot of people. Some people have been doing it, but it is a little bit more challenging. Obviously, the other option is the 14-day quarantine, which you still have to do if you don't test. I mean, the quarantine requirement is still there. Obviously, there's the state website where you can go and register if you're traveling or having folks come in for the holidays with all the different criteria that are required. And again, there's a whole page with all subsets on Forward New York. So feel free to go there and look at that information. Essential workers from the business side, that still comes into play here. So if you have essential workers that are traveling and coming back, if they are essential, they can work. Same protocol that's been in place for many, many months now, right? They have to mask at all times. They have to increase screening and monitoring. If you do have essential workers that are on quarantine, whether it's related to travel or exposure to a case, do your best to try to minimize their exposure to others. Try to, look at how they interact with folks at work. Because again, if they do happen to test positive, we want to minimize that impact to your business and operations. All right, testing. So again, continues to be limited here in Genesee and Orleans County. Obviously, Senator Schumer was out yesterday talking about rural testing and trying to increase capacity for all rural counties. Bottom line, it's still pretty much symptomatic testing. We are working on partnering with UMMC and Oak Orchard Health to try to increase rapid testing in our communities, but it is still very limited. We do not have a lot of access to the test kits. Your best bet for free testing, if you especially asymptomatic, is still this free state sites at MCC in Rochester in Monroe County, NCC in Niagara, and the Sabres parking lot in Erie County. Have to make an appointment, but we did just hear that they extended the hours due to the high demand of testing that people are calling for. 7 days a week now, I think 8 to 4 at all those locations. So got to call ahead, got to make an appointment, but that is free. So I would encourage folks to utilize that as needed, especially for travel related or screening, to maybe go to a nursing home to visit a loved one or school or whatever you may need the testing for. All right. So the last thing real quick, I just want to give an update on vaccines, right? So that's another big positive that we're finally moving towards. We're getting to the point now where you've probably seen the news. We have 2 manufacturers that have basically completed their phase 3 trials and have published their findings. We have one from Pfizer and another one from Moderna. Both of those seem very promising. They're both reporting over 95% efficacy. So that's a great number. That actually rivals some of our long-term other standard immunizations with measles, mumps, rubella. Those are around 97, 98% effective. So that's great news. And it does sound once they get their emergency use authorization from the FDA, they're going to start pumping out vaccine. There may be actually some being pushed out in the country within the next couple of weeks. They're talking about potentially 20 million doses being available by the end of the year from each one of these companies, and they're going to keep ramping that up. There's also several other drug manufacturers that are in the process in their phase 3 trials. So we do expect to have several others coming on board, shortly after the first of the year. That's all promising, right? So that's really what we've been waiting for, is to get a vaccine available and out to us so that we can start vaccinating and getting our folks protected and maybe moving beyond some of these restrictions and needs to, continue to do what we're doing. So with that being said, we have already put in our draft mass vaccination plan. Our emergency preparedness folks have worked diligently on that. And again, it's in line with what the state's plan and the federal plan are. What we do know is there's going to be many phases to this. We're going to be targeting our highest risk folks in phase 1, which include obviously our senior and vulnerable populations, including healthcare workers. Then you get into phase 2 and 3, where we're looking at more of our community-based, those with underlying health conditions and other types of settings, where we want to, provide as much protection as we can quickly, again, to open things back up. The later phases are going to be more of the general public, the well folks that don't have those type of underlying health conditions and issues. So again, this is going to be rolled in phases, and it's something that we'll be working on. We're working on it right now. We're just waiting for the vaccine to come in. So once that starts happening, again, the first couple phases are going to be more closed pods. And what I mean by closed is it's not going to be available to the general public. You can't go and just get the shots. It's going to be targeted. So it may be a nursing home, right, that we're going to give 500-600 doses to, where they will vaccinate their residents and employees. It could be a healthcare system where they're going to, again, vaccinate, the folks there and their employees. And then once that starts opening up, then obviously we're going to hopefully be utilizing our community partners, pharmacies, healthcare providers, probably us doing some bigger public clinics, and ultimately, trying to get this vaccine out as quickly as we can to the public, to those that want the vaccine. One thing I just want to throw out there for our businesses to be thinking about, when I mentioned closed pods, this also could include businesses. We've done some outreach over the last year or two to different businesses, particularly our larger ones. But what we'd like to do is really develop a list of businesses that would be interested in holding closed pods. And obviously, again, it would be triaged more at the larger businesses first. So if you have 50, 100, 150, 200 employees, the more we can vaccinate in these closed pods, the less demand there's going to be on the community side. So if you happen to be a business and you're, thinking about, hey, I wouldn't mind having, trying to get some nurses in here. And again, our ability may be dependent whether we can do this, but if you have the ability to get a healthcare facilitator in there, or you happen to have one of your business already, we could potentially give you the vaccine, all the ancillary supplies you need to provide the vaccine, and you could vaccinate all your employees, right? And maybe their families at your place of business. And again, that's a strategy that really helps reduce the community drive and the community need, because obviously these folks live in our community anyways, and then we just get them taken care of at a kind of a closed distribution or a vaccination point of delivery. So if you're interested in that, I would encourage you to reach out to us. I'm going to have a couple of my folks pop some emails in the chat box, and you can just feel free to reach out to them, name of business, how many employees you have, and if you'd be interested in being put on a list as a potential vaccination site. Again, we're not promising that's going to happen. If you're a small business with 1 or 2, 3 people, I'm not going to overpromise here. That's probably not going to happen. That would just be taken care of on the community side per se. But if you happen to be a bigger business, feel free to reach out. And we'll get you on a list, and might be able to utilize you that way. Anyways, all right. So that's kind of the update on that. Tom, I've been rambling. So I know my folks, I'm kind of monitoring the chat and my side eye here. And I know I see my folks answering a lot of these questions. So, but I'm happy to open it up if you want to read some of these questions that aren't being answered, or however you want to do the Q&A.
Okay, yeah, you're not rambling, Paul. It's all good information. And a lot of the things you said have answered questions that have come up in the chat box there. And I encourage everyone who's on the call, if they're not following along in the chat box, there's a lot of good information. David's been doing a great job answering a lot of the questions there. So I don't want to be redundant with a lot of that, because he's given good answers to many of the questions that are out there. I'm trying to find a couple that maybe hadn't got answered yet on the chat. One was, let me see if I can find it again, from Tim. Are we seeing more accurate results on quick results and quick tests, or still quite a few false positives?
Say that one more time.
Are we seeing more accurate results on quick tests, or still quite a few false positives?
Yeah, so there is a little bit of nuance when it comes to the rapid testing. It's not obviously, and there's many different rapid tests that are out there. So there's an antigen test, and there's also PCR rapid tests. What we do know is that the sensitivity and specificity, and again, I'm not going to get the nuance of some of this stuff, but the reality is, from what we've been able to identify, it's pretty good, overall with the sensitivity and specificity, which really says is a true positive, a positive, and is a true negative, upwards of 98.5%, which, is almost as good as a PCR molecular test, which is what would happen with a nasal pharyngeal, the deep dive, where they send it out to a lab. So the reality is, there is a little bit more variance potential, but ultimately, what we do know is when a positive hits, there's something there. The test is picking it up. It's sensitive enough to identify COVID. So, from that purposes, we really are pretty confident in our rapid testing. And again, we don't have a lot of it yet in Genesee or Orleans County, but what we're seeing around the state is it has been proved to be very accurate. Not to say there are not cases where you may have a false positive or false negative, but it's not as common as I think maybe the general public might think it is.
Okay, and Stephen has volunteered. If you get us the information on the pods there, and send the large business pods, we would pass that on to our members. And I see we already have 2 volunteers. Charlie from Liberty Pumps is volunteered their business for, and that's a fairly large business. And the Arc of Genesee Orleans said they'd be interested in the vaccination program too, Donna Setzkowski. So there's a couple of getting things out of that. But if you send that on to us too, we will pass that on to our membership, and you may get some more volunteers.
Great.
Yeah. This one from Bonnie Hecken. I'm not sure what her business is, but wondering, since no one could tell me last March if I was an essential business or not, if we end up closing again, could I be open for a couple of days with just limited hours? I'm not really sure what her business is. So,
Hey, Bonnie. Nice to see you.
maybe
Well, yeah, so that's a good question. So I mean, I know some of these businesses kind of fall in the gap, really. What do you operate as, those type of things. As far as if we have to reduce back down, I think that's something we could take a look at, on a case by case basis of exactly how it would work. But I think again, we'll have to examine that a little bit more, particularly if we go orange, right when we start. But yellow, you'd be fine anyways. There's no restriction there with yellow.
it looks like Cora sent along a link there for guidance for determining whether a business enterprise is subject to workforce reduction under recent executive orders. So there's a link on the chat box. Again, I encourage everybody to follow along the chat, because there's a lot of good information being posted there with some good links. Is there a place to find all testing sites? That's a question here.
Yeah, so go to Forward New York again, and we include it every day on our daily briefings. There's if you go there, there's a whole page on testing. You can actually type in your zip code, and it'll bring up all testing sites near you. And again, so it'll show all the Genesee County ones that are listed. It shows the state-sponsored ones, that I mentioned that are around us in the surrounding counties. But that's the best place to go. New ones get added on there. Like I know CVS Pharmacy in Genesee County is now testing. They were not, as of a few weeks ago. So as folks come online, they get added to that website. So we'd encourage you to go there, or recommend if people are looking for tests that they go to that site. And a lot of them are call ahead or make appointments. So make sure you look at the details of what you need to do. Because we've heard cases again of people just driving out to Monroe wanting to get tested, and they're like, well, you don't have an appointment. You need to make one and come back. So.
And is it broken down into rapid tests and regular tests, or is it just tests?
I think it just says tests. Again, I would encourage you to call ahead. I don't know, maybe David Cora could look at that. I don't think it specifies what type of testing they're doing, but it may. But if you go there, it gives you the location and contact information. You can check it, look into it.
Right. Call ahead is real good advice.
Yeah.
So. Okay, I'm not seeing any questions here that.
A quick comment on whether it says that you need to do an appointment or not. When you look up your actual location, it will tell you if screenings are required, restrictions apply, or if you have to have an appointment. So it will let you know on there.
All right. Thanks, Cora. Okay. Says if you use their websites, they will define rapid or not. Okay.
There you go. Thanks, Donna.
Any other questions? I'd actually, since we're caught up on the chat, if somebody wanted to jump in with a question and unmute themselves, I would take it right now. One at a time, please. Looks like you've answered every question there is, Paul. And your staff, you guys are great. So,
well, like I said, I think the team answered the questions and the chat helped, as we went along. Plus, I don't know if you're recording this or not, but then they could be available for folks to reference back.
Yes, we are recording this. And Stephen, how can we gotta make this available? Can you unmute? Oh, that's right. I don't think you're working it. Your mic's working. So Facebook or YouTube will have it on at the Chambers YouTube page, or it's Chambers Facebook page. It'll be available and you can pick it up from there. And I think all the links, I know Charlie asked about the links there. All the links are in the chat box there. And if you're having trouble finding one, get a hold of me or get a hold of Paul and we'll get them to you, Paul and his staff. So. Yeah, I mean, one thing, Tom, just to wrap up, obviously if there's no other questions, we're happy to stay on if there are, but feel free again to reach out to us directly. We're happy to try to answer any questions. Again, I have great staff that, on this call and not on the call that, have a pretty good understanding of the guidelines and, are happy to answer any questions that may pop up. In addition, again, kind of this continuing messaging. I mentioned earlier that, we are seeing, increase with workplace, folks coming to work symptomatic. I would just encourage you all to really be diligent about your employee screening when folks come in, and making sure they're testing every day, as part of your reopening plans that you all have, that they're not symptomatic, that they're obviously not on quarantine, those type of things. Because the more we can, minimize, again, folks working symptomatic and potentially spreading COVID in your workplace, that's going to help, right? And potentially knock more folks out of work, especially if they're positive, because they cannot work when they're positive on isolation. And again, we don't want to get in a situation where you're not able to potentially stay open because you don't have enough staff, right? So be really diligent about employee screens, and if you haven't looked at your reopening plan in a while, maybe worth just taking a look at that, especially in line with the micro clusters that I talked about, what the impact may be for you, and potentially just start looking at your contingency plans. And hopefully we're not going to go yellow, orange, red. I mean, there's no guarantees on this either way. The governor may change the strategy again. That could happen to us too. We really don't know. I guess it kind of depends on how he wants to move with things. So just pay attention as best you can to the information, and we'll continue to vet it and try to make sure we're getting out as much the factual information. Pay attention to our daily briefings, and we'll again do our best to be transparent and share what we can share as quickly as we can.
And just a final shout out, if we can have anyone interested in the closed pods, email Cora Young directly, that would be very helpful for us, and we can get you more information on that. So her email should be in the chat box, and you can put it in just one last time. Thank you.
All right, and we had a question here, when do we expect the next update on zones? I think that's just a fluent situation.
So, well, yeah, so it is fluid and rolling. What we can identify a little bit by how this is playing out, he appears to announce zones on Wednesdays. That seems to be the time period. He used to do the travel advisories on Tuesdays, and Wednesday seems to be when he changes zones. So again, we've been told that we're going to be notified ahead of time. And with Monroe County, that happened the week before. I think they got the call on Thursday or Friday that, hey, your numbers are showing you're going to be going yellow. So they had a chance to start to prepare for that and get ready. As of, I'm speaking 11:47, we have not received that call. So I'm hoping, again, we're not going to be going yellow next week. But as I mentioned, our numbers, from what we can tell, I think we're close. So that's all the more emphasizes why we need folks to, spread apart, wear the mask, distance, try to reduce capacities and gathering sizes, because if our numbers don't start trending down, I think it may put us in that yellow, orange zone. So we really need to break that cycle, and it's going to be tough. I mean, we got Thanksgiving coming up in the holidays, and again, people want to gather and get together, but it's one of those things we really, need people to buckle down, because if people aren't doing that on the social side, that's going to impact our numbers, which is going to impact you guys and your ability to keep your businesses open or not in reduced fashion.
Okay. Well, I thank you, Paul, and David and Cora and Matt for doing this with us. You talked about transparency a little while ago. There's no doubt that that's one of the great things about Genesee County and our county staff, that you guys are very transparent and do the best to try to keep everybody up to date on what's going on. So we appreciate you spending the time with us and doing this and helping our businesses out. Hopefully that'll help everyone out in the long run.
Sure thing.
All right. So we'll take care, everyone, and we'll keep you posted if there's anything else that comes up. Have a nice weekend.
Take care.
Happy Thanksgiving.
Happy Thanksgiving.
Thanksgiving, yes.